Welcome to PTCB 2026 Error-Proof Mastery. This section covers error prevention strategies and techniques for the Pharmacy Technician Certification exam, including exam tips, tricks, traps, and pearls. We begin with look-alike, sound-alike, or LASA, medications and tallman lettering. LASA medications like hydralazine and hydroxyzine present a risk of confusion. Tallman lettering is the solution, providing an instant visual differentiator for error prevention. Tallman lettering is a visual safety rule. The rule is to use uppercase for unique syllables to highlight differences. You must memorize the top 20 pairs. In the exam, always select the Tallman version as the safer choice. Another strategy is separating inventory. Physically separate LASA, high alert, and different strength medications. High alert drugs need red flags for visibility. For different strengths, use clear labels and avoid proximity mix-ups. Barcode usage is a key error prevention strategy. Scan during initial count and rescan at final verification. Overrides require direct pharmacist approval. Never bypass this. Remember, the exam penalizes failure to rescan partial vials. In math and label reading, always use a leading zero, such as 0.5 milligrams. Missing a leading zero, like 0.5 milligrams, can lead to a 10-fold overdose. Also, memorize the Joint Commission Do Not Use list for quick exam points. The trailing zero is also dangerous, as 5.0 milligrams can be misread as 50 milligrams. The correct label is 5 milligrams, without the trailing zero. The exam may combine this concept with metric conversions, so be prepared. Error-prone abbreviations are on the Do Not Use list because they lead to potential errors. For example, U for units can be mistaken for a 0 or 4. If a forbidden abbreviation appears in a SIG, the only correct action is for the pharmacist to clarify. The 3-point check reinforces the error catch rate. This involves reading the label against the hard copy during counting, labeling, and bagging. Crucially, never batch process and identify skipping the middle read as a critical error on the exam. To maintain order integrity during processing and bagging, keep all patient components together until bagged. Flagging a scenario where a hard copy is missing as a violation prevents patient mix-ups. Minimizing distractions during critical tasks, like data entry and final verification, is essential. The strategy is to use a quote gatekeeper to protect the distraction-free zone. This is the best way to reduce errors. To prevent wrong patient errors, use a second identifier for patient verification. The strategy is to quote ask and match, using information like address or date of birth against the bag and vial. This is always the superior choice over a visual-only check. Here are rapid-fire examples of error prevention strategies. Recognize the correct Tallman format, like prednisone versus prednisolone. Identify high-risk sound-alike pairs such as hydralazine and hydroxyzine, and remember to physically separate LASA drugs in different areas. The red beep protocol for scanner alerts is critical, especially with high-alert medications. If the scanner beeps red, you can rescan or call the pharmacist. Technicians must never solo override high-alert medications. Pharmacist approval is mandatory. When encountering banned abbreviations, clarity is key. The correct action is always to clarify with the prescriber. Never assume. Patient safety depends on verification and proper documentation. This pattern recognition exercise reviews leading and trailing zeros. The safe label, like 0.05 milligrams, correctly uses a leading zero. Recognizing this pattern is crucial for avoiding common exam errors. Always calculate the day's supply and perform a sanity check. If the calculated supply is less than needed, you must flag the underfill. Remember, math accuracy plus a safety check is required for the correct answer on the exam. In pediatric calculations, leading and trailing zeros are exam traps. A trailing zero error, like 0.2 milligrams becoming 2 milligrams, poses a significant risk. Points are only awarded when both the math and the formatting, with a leading zero, are correct. The Joint Commission recommends clear unit usage. Choose labels with plain milliliter per hour to avoid ambiguity and misinterpretation, which helps prevent errors and ensures patient safety.